Namaskar, dosto. Good evening and welcome to Fertility Dost's important, interesting, wonderful, informative session. And today's session we have with ART Fertility Clinic, and they are our informative or knowledge partner for this live session. For this live session, we have selected very important topic, or we can say that topic close to heart of many females because it is related to egg quality. When we start our fertility journey, the first thing, or we can say that first test, which we usually inquire about or which we usually discuss about with our friends or anybody else who is related to or undergoing the same journey is AMH. So when you just talk about कि oh god मेरा AMH तो 1.2 है and this lady sitting next to you just said कि मेरा तो 2.5 है, तो it's like that means I have less chance of conception. But is it really true? ऐसा सच में पॉसिबल है कि अगर आपका AMH कम है तो आपके चांसेस ऑफ कंसेप्शन कम हो जाएंगे, या मान लीजिए अगर आपका AMH लो है या कम है, सो यू वोंट बी एबल टू कंसीव नेचुरली. Many doubts, many myths we can say related to this AMH, or one very important aspect is egg quality. Today we really want to get deeper into this topic. क्या सच में AMH का egg quality से कुछ relation है, और अगर है तो क्या वो सच में हमारी फर्टिलिटी को, हमारे कंसेप्शन को इम्पेक्ट करता है, एंड इफ इट रियली डज देन व्हाट वी कैन डू to rectify those conditions, what we can do to improve our chances of pregnancy. And so we thought, let's call today a very special guest, a very special topic, a very special doctor to discuss about this. Because egg quality, AMH, conception, these are really important questions when we visit any fertility center. So viewers, please keep pouring your questions, your doubts ऑन आर कमेंट बॉक्स. और अगर आपको लगता है कि आपको अपना नाम लाइव सेशन पे नहीं लाना है, तो जस्ट सेंड अस अ मैसेज ऑन आवर सोशल ऑफिशियल नंबर, और यू कैन मैसेज मी personally also if you have my number, and we'll try to clear all doubts, कुछ भी related to egg quality, related to egg freezing, AMH values and all that. So we'll just call our guest doctor on the main screen and let's start with the session. Namaskar, doctor, and welcome to
Namaste.
Fertility.
Thank you so much for inviting.
Thank you. Viewers, we have Dr. Azadeh Patel with us. She's from Ahmedabad. She's a clinical head and IVF specialist from ART Fertility Clinics, Ahmedabad. So we can say that Ahmedabad people or people around that city, that area, can just reach out to Dr. Patel to solve their queries related to their fertility, whether it is male or female. But viewers, please don't visit properly. Please don't hesitate to visit, because at times we just see that fertility clinic hai, to why to enter it at early stage. So with Dr. Patel, we are going to discuss an important topic related to preventive measures to improve the egg quality. And if we talk about Dr. Patel, that her area of interest includes infertility related to PCOS and POR. And Dr. Patel, I really love to have this discussion related to POR more, rather focusing on PCOS, because PCOS is really very common topic. But again, poor ovarian reserve is really close to my heart because we have many queries related to this. Dr. Patel has authored and co-authored several international and national research articles and chapters on infertility. She believed in patient-centric approach, and this is really very important factor when we are dealing with infertility. So over to you, Dr. Patel, related to our main topic, preventive measures to improve the egg quality. We know that as I just discussed about this thing, AMH. So is it really so that AMH is related to our egg quality, or AMH means egg quantity क्वालिटी को हम पीछे छोड़ सकते हैं जब हम AMH की बात करें. सो लेट्स स्टार्ट विद दिस सिंपल. व्हाट डज एग्जैक्टली आवर AMH मीन्स, और इज इट रियली रिलेटेड टू आवर क्वालिटी?
Okay. So first, I would like to thank you for such a kind introduction, Ms. Purnima. And yeah, so we talk about the topic and we'll touch mainly for POR, which is also close to my heart because those patients are really very difficult to counsel, and they for them it is very difficult to understand their situation. So first step would be AMH, the first test that probably when you visit your gynec, and they find that probably the eggs or the number of the eggs or the ovarian volume is less, they would first suggest is the test which is called as anti-Mullerian hormone. Now, this test basically it is a hormone which is secreted by the follicles inside the ovary. So, more number of follicles, more would be the AMH. Less number of follicles, less would be the AMH. Now, first, before understanding AMH, we need to understand that how our ovaries function every month for the period, as well as for the process of folliculogenesis. So, with the process of folliculogenesis, the ovary selects one follicle which will become dominant, grow to its optimum size, and then go ahead with the ovulation of the egg inside the follicle. Now, the selection of this follicle happens from the cohort of the follicles which are selected, which are already present in the ovaries, but the ovary will select some follicle every month to select one follicle. So every month, certain number of follicles, maybe 4, 5, 10, 15. It depends on how much reserve your ovary already has. So ovaries are egg bank. So more number of money that you have, you still want to spend certain amount, but you will still withdraw more amount to spend. Maybe you want to spend 1,000, but you will withdraw say 20,000. But once you realize that, oh, my balance is coming down, the ovary will gradually decline the withdrawals. So AMH reflects what is the quantity or what are the number of the follicles which the ovary is picking up every cycle to select one follicle. So it's a direct marker saying that the follicles are less. So it's an indirect information that the ovary is probably getting empty, or it has already, the function has already declined. So the AMH value first goes down, which is it's bound to happen. And then another hormone, which is called as FSH, because it will constantly push to select the follicle, will start rising. So also in POR, we also get two kinds of patients. POR basically means poor ovarian reserve patient or a diminished ovarian reserve patient, which is a new term, where only the AMH has come down. So we are still not late. But for the patient where the AMH is down and the FSH has started rising, that means that patient is already late. The ovaries are getting pushed very faster to empty themselves. So these are the patients who need to conceive very fast. So time to conception or time to pregnancy for these patients is extremely important.
Right.
Beyond
so we
anything
can
else.
say that every time when we are focusing about this AMH values, we should also focus on this FSH values.
Yes. So AMH will indirectly tell us the quality also. More poorer the AMH, it is not always conclusive in terms of quality. It is it is conclusive mainly for quantity. But fewer the number, we expect that the quality will also be less, because it's like because the ovaries are like bank balance or an egg bank. So the better eggs or the fertile eggs would be utilized first in the initial year for pregnancy, and then later when the age advances, or maybe for certain women, the ovarian aging also happens at a very younger age. So the amount of the eggs that are left behind now are not that good, or maybe they're good enough to ovulate every month, but they're not good enough to give you pregnancy. So that will also be an indirect marker for quality.
Quality, right. And what about this testing days? If we want to go ahead with these FSH or AMH tests, so any particular days of cycle we really need to visit the lab for test, or any day of cycle would do?
So AMH can be measured anytime. of the cycle. So
Oh,
whenever your doctor feels that probably there is a threat, they can always request that test and can be done. But yes,
hmm,
better would be the second or the third day of the cycle. And other
oh,
hormones, which are FSH, LH, estrogen, progesterone, they are usually done on the second or the third day of the cycle because we want to see at what baseline hormones the ovary starts the next cycle with.
okay, understood. Right. So we can say that next time when you are visiting the doctor, make sure that your visit can be on day 2 or day 3 of
Yeah.
cycle, so that exact, we can say,
Yes.
testing of the hormones could be done. Right. And
Yeah, if required. Yes.
Hanji, right.
Yes.
So, this when we are talking about that poor ovarian reserve, so as you just mentioned that young age females are also having these issues nowadays. The first and the foremost question is, why is it so? uh,
So I would
25,
say,
26 also, I think I have seen one or two cases,
yeah.
but it's really too young because at that time we were just starting the career, or इवन डॉक्टर हैं तो हम पढ़ाई कर रहे होते हैं
Hmm.
अब तक, तो व्हाट कुड बी द मेन रीजन फॉर दिस?
So, I mean, AMH, first of all, is just a test. So, one has to also look with and correlate it with the antral follicle counts in the ovary. Sometimes there is discrepancy also. So, with the
Hmm.
younger age women having low AMH, we need to first see that. So, it should not be neglected, first of all, and it should not be taken that, yeah, abhi to my age is less,
Right,
but
right.
there is a threat. You need to understand if you are purposefully delaying something for whatever reason, you should understand what are the possibility later in terms of conception and what are possibility right now to preserve the conception. So
Right.
when at a younger age, why does it happen? We really don't know. But last 5, 7 years, we have seen that the trend of these poor reserve patients are increasing. It can be that maybe we it can be majorly what is suspected is the environmental factor because we really
Hmm.
don't know the junk food has increased, late nights have increased, the sleep patterns have changed, also the lifestyle has changed a lot of, I mean, alcohol, smoking, all of it. So we really don't know what is impacting because gametes in any body, male or female, they are very, very delicate cells and they are the easiest to be attacked by the toxins. So all this very unhealthy lifestyle, stress level, all of it is going to impact and cause a lot of oxidative stress in the body, which is going to destroy these cells. So maybe that is the reason where we cannot find any other pathology. So take for example, there can be pathology, say endometriosis. It is a
Hmm.
condition which affects the ovary, and there is a cyst which is called as chocolate cyst, which forms. Now, if the younger women, is suffering from endometriosis and she is having a progressive endometrioma, that explains that why her ovarian reserve is less. But for
Right.
patients who do not have any cyst or any endometrioma, everything perfectly fine, otherwise healthy, or maybe if she doesn't have any other chronic condition in her body, say hypertension, diabetes, or thyroid, or anything. So then in those cases, we can probably blame the lifestyle or the environment factors probably responsible for it. But in those cases, those women really need to understand their chances because it is not going to give them any symptoms straight away. So I always explain patients it's like a diabetes. I mean, nobody can tell you have diabetes or you don't unless you
Right.
test. Because in initial years, it is not, it's a silent killer, kind of. You will find out or you'll start having symptoms when the condition has already progressed. So similarly, the reduction in the ovarian reserve will not give patient any problem. So for them, the cycles would be regular, everything would be fine. They don't know their fertility is declining at such a fast pace. But
Right. Right.
gradually, if you see, the cycles will start shortening. So from 30
Hmm.
days, it will become 28 to 26, 24 days. So that is alarming for the patient because instead
Okay.
of 12 cycles every year, they are ending up with
Hmm.
13, 15 cycles. So the ovary is depleting the number of the follicles very fast. So that
Okay.
is one of the early signs, at least, and not early, a later sign that the patient
Later
can
sign. Right,
complain of.
right, right. Because
Yeah,
whenever we have such cases, then females just mention this कि अभी तो periods normal हैं, कुछ ऐसा हुआ
exactly.
नहीं है. डॉक्टर ने क्यों बोला कि आप जल्दी
Hmm.
प्लान कीजिए. So I can
Hmm.
say that if your doctor is saying or she is just mentioning that you really need to think about this, so please, it's an alarming sign, we can say.
Yeah, it is alarming. It is alarming.
Right. So Dr. Patel, you just mentioned that जो पीरियड साइकिल का गैप है वो धीरे धीरे छोटा होने लगता है. And what
Hmm.
about the flow? Because many women just mention about this scanty flow. Is scanty flow also related to this condition?
Yeah, so there can be, if, I mean, we exclude the pathological reasons or correctable reasons, which may be, they're not normal. Everything,
Hmm.
excluding the pathological reasons which are responsible for reducing the flow, we only concentrate on the hormonal part right now, right?
Hmm.
So, with the process of folliculogenesis, the follicle develops. Now, this follicle will be secreting a hormone called as estrogen. This estrogen will act on the uterus and form the endometrium.
Right.
So, if the follicle is not good in quality, or
Hmm.
the estrogen secreted by that follicle is not good, why is it not good? Because of the hormonal disturbance or the egg quality within,
Equal.
right? So
Right.
that will not contribute to form a very good endometrium. So a thin endometrium, obviously, if the thickness is less, the flow that the patient will have will also be less.
Right.
So we have to exclude other factors which can possibly cause the infection or adhesions inside the uterus for any other reason, probably contributing to reduction in the flow.
Flow. Right.
If
So
not,
this.
and if the AMH is poor for that patient, then
Mhm.
of course it correlates. So this patient, when we give hormones from outside to develop their endometrium, they develop very, very well, and then
Hmm.
they have a proper flow.
Okay, right.
So yes, it's
So
usually correlated.
correlated, right? So we can say that if your period cycles days are becoming shorter or periods are becoming scanty, you really need to visit your doctor.
Yeah.
Dr. Patel, one more thing. When say at 25 or 26 years, we are not planning our family, and at this early stage, I could say that 70 or 80% of females are still not with partners. So what could be the preventive measures? Because when we are married, so it's easy, we just visit the doctor and says कि ठीक है हमारे embryos freeze कर
Hmm.
दीजिए. But when we are not with our partner, then what? How to prevent, or I can say that preserve our fertility at that stage?
Yeah. So first of all, the medicines, they will be of a very, very limited role. So
Hmm.
one should not completely rely absolutely on medication. The
Oh.
lifestyle needs to be taken into consideration.
Hmm.
From your side, what you can do is improve your lifestyle. So sleep on time, at least 8 to 9 hours of sleep. So late night is not good because it breaks your circadian rhythm, and that
Hmm.
deranges the hormone. So the healthy lifestyle: sleep on time, eat healthy, eat green leafy vegetables and other fruits. Add that to your diet because they give a lot of antioxidants, and they that helps to prevent the damage done by the oxidative stress, which is created within the body. Because that stress will destroy the eggs because the ovaries are located within your body, unlike men, where their gonads or the testes are located outside their body. So
Outside.
they are
Right.
not directly subjected to this stress within the body. But for women, the ovaries are located within. So for us, it is very, very important. Try to remain stress free. So yoga, meditation are something that can help. Always incorporate little bit of exercise. Maybe even walking is fine. 40-45 minutes is good. A little bit of exercise is really good. Take your dose of multivitamins. This is what, if everything is fine, you can do. But if your reserve is found to be, say, less, say at the age of 26, your AMH is around 1.5, 1.6. So we are very borderline or maybe in the low fertility. So in this cases, you need to add up specific antioxidants and micronutrients and microminerals, which are very strong antioxidants to help prevent further damage.
Okay.
So
Right.
that has to be taken for at least 2 to 3 months, but it won't be enough. That probably has to be repeated if you are trying to still delay. But if you are young and you find that the reserve is less, and there is always option to preserve your fertility at a younger age with the process of egg freezing. This is very simple process, takes at least 8 to 10 days. There are injections involved, checkups involved, but it is very easy process to undertake. We remove your eggs and we freeze them. So even later, when you are trying to conceive, when you want to conceive and you cannot, and probably your AMH that time was 1.6, and after 3, 4, 5 years, it has dropped down to zero point 0.6, zero point 0.7, and you are still finding difficulty to conceive, you can always utilize the eggs which were frozen 4, 5 years back with the process of IVF to create your embryos and achieve pregnancy. So
Right.
that is something that one has to be mindful. Otherwise, basic healthy lifestyle is something that will always help.
Right. And we can say that this egg freezing is really catching up with the younger generation thanks
Yeah.
to our Bollywood stars or page three people, that we are now more focused about our fertility. Dr. Patel, like what could be the freezing period? Usually it people says that 10 years is too much. My eggs, they will lose something, they lose, the quality will be bad with each progressive year. So is it really possible that while we are freezing the eggs and when we are thawing it back, the quality will be compromised?
More or less, no. But yes, we really don't know what are the long-term implications if we freeze with the process of vitrification or cryo. When we use the cryoprotectants and we freeze the gametes or the embryo, we really don't know what are the long-term implications. But what we can do is, as per right now, the laws have changed and we can freeze the gametes for 10 years. That is the maximum time that we can freeze. Now, we
Hmm.
have to understand this freezing is kind of social or elective freezing. It is not kind of a compulsory freezing for patients who are cancer patients and they have to go ahead with chemotherapy, radiotherapy, and for them it is an urgent situation and they have to go for freezing to preserve
Hmm.
their fertility is something different. But for patients who are taking it for the social egg freezing, they are
Right.
doing just to keep that as a security. Okay,
Right.
so the best would be that you try to conceive as early as possible. But if you still want to delay, it's better that you freeze your egg so that
Hmm.
you may or may not require. It is not that आपने freeze करवाया ही है, so that is all what you have to use. You have to
Huh.
try naturally. You have to try alternative methods, whatever works for you, and try to prevent that you don't have to use those eggs. But in an extreme situation, when you try to conceive, probably you are facing issues related to egg quality that time and fertilization. At least this can come to your rescue. And this is a science which is researched for decades now, egg freezing, and it's very commercially available and at least very safe.
Right. So if you are in this situation with low AMH and doctor is advising you and you are still searching for a partner, then please don't hesitate to freeze your fertility. It is, we can say that better, good, better, the bestest option available right now with advanced technology and science. Dr. Patel, we'll take few queries over here. So, okay, I think we just mentioned, you described about these things. Please suggest some natural remedies to boost egg quality. The best is to change lifestyle, and other
Yeah,
Dr. Patel will tell.
yeah, yeah. So lifestyle is extremely important, and the second is what you take in the diet. So of course, the junk food is not at all good. So that has to be restricted. Second, add up healthy diet. That is, add up green leafy vegetables, fruits, and if you are allergic to gluten, avoid it. That is all what you can do. Take your multivitamins because many a times the deficiency of vitamins also lead to reduced egg quality. Also check if you are not suffering from any chronic condition. So basic health checkup, because even hypothyroidism for patients, because that is majorly correlated in women who are having poor reserve. They are usually hypothyroid, and sometimes hypothyroidism is an autoimmune condition. So autoimmune condition is where your body does not recognize the cells of your body as their own, and they fight against it and go ahead with destruction. So autoimmune thyroiditis is one of the risk factor for poor ovarian reserve as well as premature ovarian failure. Also, if
Okay.
you have anybody, I mean your mother or your sister or anybody who has a history of premature menopause, that is one of the very uh, important risk factor, that you have a close relative of yours who has a premature menopause or who has suffered from because of the poor ovarian reserve, then you have to be vigilant. Otherwise, that is all what I can suggest as a natural remedy. And yes, yoga, meditation, and exercise. Nothing else.
Right. And if you are really thinking about joining yoga meditation sessions, then please do let us know. We have in house experts for this. Dr. Patel, when we are talking about low AMH or when we are talking about poor ovarian reserves, a few technologies are there which help us to preserve to nahi kahenge, which help us to just rejuvenate our ovaries. Is it really true that these technologies help? Because we have one query related to this: what is better, stem cell or PRP to improve egg quality? And सच में क्या improve होती है egg quality?
So now PRP is something that has some evidence to help in ovarian rejuvenation, but it is mainly tried and tested in patients who are into failure. So now poor ovarian reserve is when the function is declining, and premature ovarian failure is when the ovary has given up, when your
Right.
FSH has started rising and it has risen to a level. So for these patients, these technologies have been used, and we really don't know what helps. Is it the PRP that goes in or the stem cell that goes in and helps in rejuvenation, or it is just a mechanical injury to the ovary that
Hmm.
is helping the ovary to activate and throw more eggs, because it will still contain eggs. So now there is a theory where at the time of the birth, I mean, these eggs are already produced in the female body when she was the baby in her mother's uterus by the
Right.
age of 4 months. So they are produced to like 60 to 70 lakh eggs are produced already during that time. And then slowly, there is a decline. Once she achieves her puberty, she is left with almost, say, 10 lakh eggs, approximately 8 to 10. So the starting point, so whether you start with 13 lakh, say it's 13 lakh eggs when you have your menarche or your periods, you start
Hmm.
with 7 lakh eggs. That will decide your reproductive age, कि आपको
Right.
कितने टाइम तक पीरियड आएगा, क्योंकि दैट इज गोइंग टू गो. उसके बाद जैसे पीरियड आएगा तो एवरी मंथ देर इज गोइंग टू डिक्लाइन. So poor ovarian reserve is when the function is reducing. Maybe you have 1 to 2 lakh eggs left in the ovaries. Poor ovarian reserve. And premature ovarian failure is when you are left with maybe 10, 15,000 eggs in your ovary. Right.
Right.
So PRP or stem cells are usually tried in patients who have failed. But for POR, the only thing that works is antioxidant supplementation with the testosterone or a precursor of testosterone, which is DHE.
Hmm.
And the only thing is take those eggs out by the process of IVF and try to fertilize them externally. That is all what. Don't concentrate to improve your reserve, because probably that will not improve. But it is
Hmm.
better to take them out, fertilize, make the embryos, because they would be challenging eggs as such. So
Right.
just don't focus, keep on focusing on improving your reserve, because that is very, very time consuming, maybe 3 months, 6 months, and you will lose whatever the eggs you will be throwing, your ovary would be throwing up in those 3, 6 months.
Right. So I think age matters, and proper diagnose and visiting a right doctor is really important.
Yeah.
So Ahmedabad people, please don't hesitate to visit Dr. Patel and do check with your fertility at the right age, right time. So, Dr. Patel, we'll take few more queries. Okay, we have taken this just one which I had with me. You just mentioned about, we discussed about these two process, stem cells and PRP. And one very important query either we have is कि मैम हर महीने जब हम स्टिमुलेशन लेते हैं तो हमारे ओवरी में से अंडे निकाल लिए जाते हैं। तो
Hmm.
अब अगर आप इतने अंडे निकालेंगे तो अगले महीने ओवरी तो कुछ नहीं बनाएगी। तो
Oh,
प्लीज डॉक्टर
so
पटेल, क्या सच में वो अंडे निकल गए और अगले महीने ओवरी क्या करेगी?
yeah, true, true. I mean, this is a very, very frequently asked question. So with the process of IVF, when we start giving injection, the focus is जो ओवरी स्टार्टिंग पॉइंट पे जितने फॉलिकल्स उन्होंने उठाए हैं, दो ओवरी जो भी दोनों मिला के, जो भी 7 8 10 वट एवर, इन केस ऑफ लेस रिजर्व 3 4 5 जो भी हो, तो आउट ऑफ दैट नेचुरली इट इज गोइंग टू सिलेक्ट ओनली वन. But starting point may take, for example, we have 10. So out of them, one will be selected. But when we stimulate or when we give injection to the patient, the intention is that ये सारे 10 के 10 बड़े हो.
बड़े हो जाए,
The
राइट।
follicles which are selected already for that cycle are destined, उसमें से एक select होगा, बाकी के मर जाने वाले हैं. They are going to die. The ovary is as such going to empty itself of that follicle. So when we give injection, we try to grow all of them, and we take eggs from these follicles only. The
ओके,
other follicles which are already there in the ovaries, they stay there. We don't pick up any other follicle because we cannot see them. Obviously, we will be puncturing only the follicles which have grown. So the ovary will have a lot of follicle and it has lakhs of follicles. So with an ovarian IVF pickup, when we do the ovum pickup, the retrieval is only a limited number, say 8, 10, 15, 20, maybe 25, number, whatever the ovaries both combined can give. But those are the follicles which were as such selected and they were destined to die.
राइट। तो ऐसा मत सोचिए कि हम कुछ खींच के बाहर निकाल रहे हैं, जो आपकी ओवरीज में उस महीने में हमें आई मीन डॉक्टर्स को नजर आ रहे हैं, सिर्फ वो उन्हें ही निकाल रहे हैं और अगले महीने आपकी ओवरीज फिर से उतने अंडे जरूर बनाएंगी। डॉक्टर पटेल, यूजली वी हियर दिस वर्ड स्लीपिंग मोड ऑफ द ओवरीज, व्हाट एग्जैक्टली इज दिस?
Sleeping mode?
या फ्यू क्वेरीज वी हैव रिलेटेड टू दिस के पिछले महीने तो बहुत सारे फॉलिकल्स नजर आए, इस महीने दो ही, तो डॉक्टर ने बोला आपकी ओवरीज अभी स्लीपिंग मोड में है, प्लीज टेंशन मत
Okay,
लीजिए।
so okay, so that is also the first time for me. But yes, when we have patients with poor reserve, the ovaries also go very irregular. So some months probably they select 5 6 follicles. Some months they might select 1 or 2 follicles. So that can happen because it is also an organ which is realizing कि यार मेरी एज अभी 36 है और मुझे 45 साल तक पीरियड देने हैं. So one month it will give more, the other month it will realize that no, I have to conserve because it's only one follicle it has to select and ovulate, which either it can pick up one follicle and grow that, it can pick up 5 and grow one and ovulate. So the ovaries are very, very tricky organs and to understand as women are. So yeah, so we really don't know how the ovary selects the follicle. But yes, when you are considering an IVF cycle, when your doctor says that okay, this is a good month to start, when the ovary has picked up reasonable amount of follicle or the best amount of follicle in your case, you should start and not delay because you really don't know what would be the next cycle. It
नेक्स्ट,
can you might just have to postpone your cycle 2 3 cycles if the ovaries fail to pick up those many follicles then.
right. And we can say that after this session you can just make it a statement that we always say that women are difficult creatures to understand, so are ovaries, because they are also females. So
Yeah.
we'll just proceed to next query over here. So, if AMH is low, how much aggressive action to be taken for conception? That is, AMH is 0.36, age is 34. What action individual need to take? Should she wait and continue trying for natural?
See, the chances of natural conception are never zero unless and until you have achieved menopause. So one cannot comment that you there are no chances that you can not conceive naturally, but it is about the statistics of what are percentage chances. Root, I mean, on an average at this age, 34 years of age, when you are trying to conceive, the fecundity or chances of conceiving per cycle is very very less. So maybe around 2 or 3% every month, every cycle, 2-3% chances. Again, now this is generalized for 34-year-old women, and this includes women with an AMH of 2.5 also. It includes women with the age of 0.36 also. So a woman with an AMH of 2.5 probably might be a good candidate to conceive in that 2-3%. But for you at the age of 34 with an AMH of 0.36, along with your intrafollicular count being less, you don't stand that much chance. You might conceive, we don't know, but losing every month in a hope that you might conceive naturally or you should try to conceive naturally might be more loss making than trying with an IVF cycle. Because with this poor EMH, which I just mentioned, the quality of the eggs that we routinely see with the IVF cycle, they are difficult eggs. I would not say bad, but they are difficult eggs to fertilize also. So
Hmm.
naturally, if one of the poor quality egg is selected, which we don't know what happens in natural cases. So if a poor quality follicle, which has a poor quality egg, if that is selected and it fails to mature also, we will not have any answer, because that is something that we see routinely with IVF patients, that despite of growing follicles, say 4-5 growing follicles, she might just end up with two mature eggs. Maybe she has 5 eggs which are retrieved, but out of them two might be mature. So that is a situation which is very much possible when you are trying naturally also. But all
Right.
those answers are not possible for you to get when you are trying naturally. What your doctor can only tell you is whether the follicle has developed in a proper diameter, I mean the size, or whether
Hmm.
it has ovulated. मतलब वो फूट गया है कि नहीं. Where, what was the quality of the egg, whether it was a mature egg or not, where it went, did it ever achieve fertilization within? Those सारे questions are impossible to answer. So nobody can answer you. So it is better that you should go very, very aggressive. You should try IVF and at least take your eggs out and make them fertilize forcefully.
Right. And as they always say is that only one healthy egg is enough for pregnancy. So
Yeah, yeah,
please focus on that quality and
exactly.
healthy egg also.
I
As
cannot, I have enough example of this, that eventually it is just one egg, one embryo, one baby. So don't focus on number. Definitely, if even EMH is bad, we have enough experience to work with this poor numbers, and we will try our best. I mean, if there is something which we cannot correct, but whatever the best that we can offer, we will always try to do that for you. So
right.
don't lose hope. AMH alone is not at all an indication for egg donation. You can always try even if your AMH is zero point 0.2 and you have one or two follicles in your ovary. It is just that you have to understand the chances and the negative outcomes also. That is all what you need to understand.
Right. And we can say that yes, when you are growing in age, your ovaries are also growing along with you. एजिंग आपकी भी है, आपकी ओवरीज की भी है, दोनों की साथ साथ है। तो अच्छा है कि जब हम अपनी एजिंग पे काम कर रहे हैं तो थोड़ा सा ओवरीज की एजिंग पे भी काम कर लें। डॉक्टर पटेल, यूजली जब हम बात करते हैं तो पीपल सेज कि लो एएमएच की वजह से क्वालिटी खराब हो गई, या डॉक्टर ने स्कैन देख के बोला कि आपके एग की क्वालिटी ठीक नहीं है। इज इट रियली पॉसिबल टू चेक द क्वालिटी ऑफ एग while
See,
doing
while doing a
while doing a TVS scan or ultrasound whatever, because
No,
usually
no.
लोग बोलते हैं कि ये हमें पता चला, एंड वी वर रियली शॉक टू हियर कि हाँ भाई ऐसे मिथ्स भी चले आ रहे हैं. तो आई रियली वांट
No.
यू टू गाइड आवर व्यूअर्स कि हम एग की क्वालिटी कैसे पता कर सकते हैं.
See, egg quality is a very difficult uh, situation to explain to the patient.
Right.
First of all, neither AMH can tell me that the quality is bad. It is only and only a quantitative marker. Even a patient with one egg can form one embryo and can give live birth. So quality
Right.
is out of question. It is just that she is having less number. So that is one thing. On the basis of TVS, when the ultrasound is done, what we check are the antral follicle count, which are
Hmm.
again the number. It's a
Hmm.
quantity, how many follicles are there in the ovary. But again, it is very, very subjective. It can have, for me, I can feel that there are five, and I feel that's enough. I'll be happy with a patient having five antral follicles because we deal with a lot of women which have 1 to 1 2 antral follicles also. So for me, five is good. We will be happy.
Right.
So that is one thing. Some other person or some other doctor might feel that five is less, right? Both are correct. What I want to say is both are correct. Because with an antral follicle of five or an advanced age, or maybe an AMH less, the chances of conceiving are less and not zero. So
Right.
what I just commented, it is just to understand what are your chances. So for these patients, I usually counsel that probably you will need 2 3 cycles, which
Hmm.
we call as cryoaccumulation, and we make the embryos and then select the best embryo to transfer, because we are now focusing on the fertility part, because we really don't know whether the first transfer would be successful or not. Because
Right.
when we are dealing with higher age, poor AMH, all you have to, I mean, we take a lot of time to make patient understand that the chances comparatively are low.
Hmm.
Obviously, egg donation is an easier option where you take eggs from the fertile young women, which are easier to fertilize. They will form more number of embryos and they will give 70-80% pregnancy rate. But here you are talking about is genetic, your own genetic biological child. So with
Right.
that, even if you have like 25% of chances of conceiving with your own eggs, I think that is the first thing one should do. Then directly opting for egg donation. I would not advise egg donation directly to any patient.
Right. Right. Understood.
So
And we
quality
can,
cannot be assessed by TVS.
बिल्कुल. तो अगली बार जब आप स्कैन, टीवीएस या कुछ भी ऐसी चीज़ करवाने जाएँ, तो समझ लीजिए कि आपकी एक क्वालिटी का मेजरमेंट नहीं हो सकता. एंड
Yeah,
आई वुड से दैट डॉक्टर पटेल, पूरे सेशन में, इन दिस होल सेशन, यू नेवर वंस मेंशन्ड अबाउट कि ऐसा नहीं हो सकता. इट वाज़, आई कैन से दैट वेरी प्रोग्रेसिव टॉक वी हैड. आपने लो
yeah,
एमएच पे भी बोला कि हो सकता है, आपने कम एएफसी पे भी बोला कि हो सकता है. सो थ्रू दिस सेशन वन वेरी इंपॉर्टेंट एस्पेक्ट इज व्हेन योर डॉक्टर इज होपफुल, देन व्हाई नॉट यू. It's just a matter of time, or we can say that selection of right doctor, जहाँ पे थोड़ा सा आप मेहनत कीजिए, बाकी आपके डॉक्टर देखेंगे. And as
that,
we just mentioned in the starting, Dr. Patel has this protocol of following, and we can say that हर इंडिविजुअल अलग है. दिस इज द मेन मंत्रा
mm,
फॉर डॉक्टर पटेल. सो प्लीज सी टू इट, एंड इफ यू आर रियली वांट टू सीक हेल्प, आपको लगता है कहीं ना कहीं आप कंसेप्शन में पीछे जा रहे हैं, एज के साथ, टाइम के साथ चीजें बदल रही हैं इन योर रिप्रोडक्टिव सिस्टम, एंड एज अ फीमेल यू कैन easily recognize the changes with your period cycle days, flows, and other things that just Dr. Patel
yeah,
mentioned. Then please don't wait longer. And I would suggest Ahmedabad people, Ahmedabad couple, ladies, please do visit if you have any concerns related to your fertility. Any parting note for our viewers, Dr. Patel? And I would really appreciate आपने पूरे सेशन में होप को जिंदा रखा, बिकॉज
yeah,
पुअर एग क्वालिटी, लो एएमएच, ये बहुत अंदर तक छेड़ने वाले टॉपिक्स हैं. दिस इज लाइक वेरी सेंसिटिव इश्यूज व्हेन वी टॉक अबाउट
yeah.
दिस, एंड पॉजिटिव
No,
अप्रोच from a doctor is really great thing. So please.
no, I mean, yeah, I would definitely like to uh, say that time is very, very important in this cases. Also, as you just mentioned, for the quality, unless and until you visualize the egg once it is out under a microscope, the comment on the quality of the egg cannot be made. Even if it is a poor quality egg, if it forms a beautiful blastocyst for you, the
Hmm.
there is no question of the quality. And that blastocyst or the embryo, if it gives you pregnancy, then what else do you need, right? So quantity or the number is just one thing. I mean, it doesn't define quality. Yes, in major cases, the once we have a low number, it is, of course, the quality would be compromised, but we can still try with those eggs. I mean, with the husband semen compromise with a count of 1 to 1 million, don't we do IVF with those cases? We don't suggest donor, right? But with females, we usually, there was a trend that it was very easy to suggest a advised donor, because for females, they had to accept, because it was a male partner who usually takes that decision, because the finances are involved. But if I look, I mean, I am always very sensitive to this, and I've also performed IVF in patients with 0.18 AmH, and I have two beautiful blastocysts for her. So I always be hopeful that unless and until you have tried, and there are many, many stories to tell with poor response. I don't know. I mean, I really don't know whether we will succeed or not, but at least I can give them hope that at least we can try. And even if
Right.
I succeed 3 patients out of 10, I would be happy that they could go back with their own child. So that matters to me more than anything else. Baki to, if they don't succeed with their own eggs, obviously egg donation is always there. But we can
Right.
try whatever. The only thing is that the women or the patient has to be mentally very, very strong and accept that she has to pass through a certain process. But there is, and she has to be patient. It should not be कि नहीं नहीं ये होना ही चाहिए अभी IVF करो. That's a routine thing, right? That they cannot accept that IVF also has failures because they are patient. कि ही जो है वो होता है. You just have to understand what probably caused the failure. That is it. And never
So,
lose hope. You should try.
right. That is the most
Yeah.
positive part of whole
Yeah.
session, I can say. So, low AMH, poor ovarian reserve, yes, कुछ तो क्लिक हुआ है, but again, as Dr. Patel just mentioned, don't lose hope. It is really important. आप एक कदम आगे बढ़ाइए, हो सकता है आपके डॉक्टर 2 कदम आगे बढ़ा के आपको हेल्प करें. Always choose right doctor, right clinic at right age. That is really important because we females has this tendency to play hide and seek with age. So please बी केयरफुल अबाउट योर एज. बाद में आपको ऐसा ना लगे कि मैंने देर कर दी, शायद 2 साल पहले ट्रीटमेंट शुरू कर दी. एंड वंस अगेन थैंक यू डॉक्टर पटेल, थैंक यू सो मच फॉर ज्वाइनिंग टुडे. थैंक यू ART फर्टिलिटी क्लिनिक फॉर अरेंजिंग सच वंडरफुल सेशन. डॉक्टर पटेल, बहुत मजा आया आपसे बात करके और हम जरूर चाहेंगे कि आप दोबारा हमारे सेशन में आए. और हम ये भी
Thank
चाहेंगे कि आपके आसपास की हमारे जितने भी व्यूअर्स हैं, अगर कुछ उनको इश्यूज हैं, कुछ प्रॉब्लम्स हैं, देन प्लीज they should visit you. Viewers, just send us a special one single message will do. आप comment box में comment कर सकते हैं और just send us a mail or SMS on our official number and we will directly connect you with Dr. Patel. Thank you, doctor, for joining today.
thank
Thank you.
you. Thank you for having me. Thank you so much.
Thank you. Bye bye.
Bye.